Welcome to Fast Physio Facts with me, Mick Hughes. This is your weekly dose of evidence-based practice and hot clinical tips to get you through your week. Today's paper is hot off the press from the British Journal of Sports Medicine, led by Selhorst and a wonderful group of authors who have put together a wonderful paper looking at treatment options for those young sporty kids who are presenting with acute athletic low back pain. This paper in particular is a full text open access paper which you can get for yourself, but we'll provide the links for you on the Learn.Physio website and also on our YouTube channel. So more often than not, young sporty kids who present with athletic low back pain often have the diagnosis of a lumbar pars stress injury or an active lumbar spondylolysis, which is how it's often referred to. Often the management is prolonged rest after that initial diagnosis, more often than not evidenced by MR imaging and stress and bony edema in the pars interarticularis area of the lumbar spine. So this group of authors wanted to ask the question and figure out, can we get these young kids moving early, and does it affect their long-term outcomes? And so ultimately we're looking here in this paper as to whether we can start physiotherapy early and progress based on symptoms and criteria-driven rehab, and compare that to a group who was advised to rest early and were led through time-based protocols. So this study population is a randomised controlled trial and a multicentre trial based in the US at two paediatric hospitals, one in Ohio and one in Colorado. They included 64 adolescent athletes aged 10 to 19 with a median age of about 14, and 40% were female. Inclusion into this trial had to be via MRI and an active spondylolysis being evident on MRI, or what's known as bone stress injury or edema in the pars area of the lumbar spine. They also had to be involved in organised sport and regularly playing organised sport. There was a lack of detail there in the paper about what those organised sports were, but organised sport twice a week was the inclusion criteria here. Important to note for us Aussies down here who manage young sporty kids, cricket fast bowlers are a subpopulation of kids who often have these pars stress injuries. This being a US-based sport, US-based population study, highly unlikely there's going to be many cricket players included in this study cohort. So just take care when generalising some of these findings, especially if you're dealing with young cricket fast bowlers. The interventions of the two groups. So both interventions were initially advised to rest from sporting activities. They weren't advised to brace, so no bracing involved. And throughout the trial, they all did individualised physiotherapy sessions at least twice a week for 1 hour per session until return to sport criteria were met. Now, the two groups were broken down into immediate start physiotherapy group and then a wait physiotherapy group. So the immediate start group started physiotherapy within 1 week of diagnosis and were progressed based on pain and functional criteria. Phase 1 exercise for those who were starting rehab early were all based on strengthening and maintaining musculature around the trunk in a neutral plane, so as to not stress the lumbar area, particularly into extension. They also worked on flexibility and some hip muscle control and scapular muscle control. Manual therapy is indicated and pain relieving modalities as indicated as well. Phase 2 progressed through to functional exercise, where up on feet, moving into flexion and extension as tolerated, and progressing their hip strengthening and scapular strengthening, and also introducing light jogging, running and jumping as tolerated through this phase. Phase 3 was their return to sport phase, where they were really guided back to sport based on their own sport specific demands. The rest group, however, did no exercise beyond daily activities until the pain resolved for 2 consecutive days in a row. Then they started their physiotherapy treatment and were progressed on a time-based pathway. The return to sport criteria for both groups were pain-free lumbar end range flexion and extension, completion of 2 weeks of return to sport activity with their physiotherapist pain-free, and 0% on the Michelli functional scale outcome measure. Now, the key results were fascinating. Key results here I'm going to spell out for you. Pain and function at 1 month, which was the primary endpoint. The immediate physiotherapy group were clinically and statistically better at 1 month compared to the weight group. So much so they had a 21-point advantage on the Michelli functional scale score. Return to sport. The immediate physiotherapy group returned to sport on average 38 days sooner than the weight group, which spelled out to be 74 days, so about 2.5 months versus 3.5 months in the weight group. Importantly, there was a really important improvement in recurrence rates as well. So the early group, their recurrence rates of back pain over that first 12 months was 3% versus 29% in the rest group. So big differences there. And importantly, there were no adverse effects or events recorded during the 1 year in either group, especially in the early intervention group. So this is a massive finding, and big takeaways here for me is that we can definitely introduce safe, effective loading in our younger athletes who are presenting with acute athletic low back pain, in particular the diagnosis of pars stress or a lumbar spondylolysis. And it really challenges this held belief that we have to wait and rest in this young population. And it's clear in this one study, and as far as I understand, it's the only study of its kind where we're comparing an early intervention group that was criteria driven. And being a massive proponent of criteria driven rehab with ACLs, it's great to see this applied in a low back pain setting as well. So for many adolescents with active pars stress injury, this early guided physiotherapy can actually improve short-term function, speed up their return to sport, and reduce reoccurrence. And the early rehab wasn't reckless. It was sensible, it was symptom guided, and it was safely progressed with time. And the details of what protocols they did in the paper. So feel free to download that. It's a free open access paper, as I mentioned before. So yeah, rest is necessarily not best for a lot of different injuries, and in particular this case here with our young athletic population. So I urge you to read this paper. It's a wonderful paper, and yeah, if you work with athletic teenagers, and in particular those that have high rates and high incidence of low back pain, this paper is a must read. Just a quick reminder, once again, our Aussie cricket physios down here with fast bowlers, just take care when interpreting these results. So there it is, Mick's Fast Physio Facts, episode 1 down in the books. I hope you enjoyed it. Hope you learned something from it. And I look forward to bringing you more of this over the next few months.